Hello everyone. I just wanted to thank those who responded on the little contest that I had placed out there by email regarding this graph and what it indicates. I'll get to this just in a moment and who the winners are of one of these spine models. Actually, I chose two winners. I was feeling generous. Two people answered correctly. So anyways, I just want to share with you quickly, kind of fun, but I don't know if you guys know, but I have a whale spine, a segment of a whale spine suspended above the treatment table. And this was donated to me by a fisherman that picked them up off the bottom of the ocean, and I just wanted to share with you. I'll get a comparison here, but here is you can see the comparable differences. This is actually a blue whale, so the largest vertebrae. This is in the lumbar region, and interestingly, you can see, well, I had it suspended so we can show disc height changes. So I wanted them individually suspended, so they're got a sort of a unique installation here. Normally they core the vertebrae and slide them on like skewers, and they simulate the discs, but I wanted to show these subtle changes in disc height. Interestingly, you can see this trough here, this rounded trough. Well, this is actually the area where the main artery courses down onto the vertebral body. So you can see the sheer size of the vertebral, or sheer size of the artery here. I think, you know, our lumbar vertebrae 3 times over can fit inside. So anyways, kind of this is kind of where most of the inspiration of the models occurs, when when patients come in and complain of this or that. And but anyways, coming back to this publication, the changes, these are diurnal changes over the course of the day in millimeters of height of the intervertebral disc. So you can see that upon first lying down, there is a quick change of increasing height. So this is, I think, an important clue to recovery. So for me, I even get patients to lie down 5 to 10 minutes over the course of the day at certain intervals to help recover some of this disc height. And then, of course, upon first loading in the morning, you can see that quickly the disc height changes, and then it's gradual over the course of the day. So to me, this is a very important, this is an important graph to sort of think about clinically. I'll give you the link to the full text here. Well, not to the full text, but to the article, so you can find. If you need the full text, just email me and I can send this to you. But importantly, I think that graph is such an important thing to think about when patients are coming in and they're complaining about symptoms as it relates to the time of day. These models can demonstrate that. So over the course of, the first thing in the morning, for example, the disc height changes very quickly. So there's compressive changes, and that's often when patients are presenting with symptoms. Conversely, you could talk about the act of lying down and how that, if just lying down for 5 to 10 minutes can actually increase the disc height, taking stress off the facet joint, or whether you're suspecting a discogenic component. These models can show those diurnal changes as it relates to the patient's symptoms. So I hope that was helpful.